Did you know that over 1.3 billion people worldwide they suffer from high blood pressure, and most of them don't even know it? But here's the real kicker. The way we manage and treat elevated blood pressure has just changed dramatically in the last 10 days. So if you are a healthcare professional, a doctor, a medical student, or just someone who is interested in health, you need to know about these new 2024 guidelines from the European Society of Cardiology, which were released here in London a couple of days back. Why? Because understanding them could literally save lives. Hi, I'm Dr. Said Kazmi, and in this video, we are diving into the major updates and changes in the 2024 European Society of Cardiology guidelines for managing elevated blood pressure and hypertension. Now, we will break down this into what's new, what has changed, and most importantly, what it means for the treatment in a way that's easy to understand and implement. So first up, let's talk about the major changes. The 2024 guidelines aren't just a minor tweak. They actually represent a shift in how we approach blood pressure management. So the first major change is the new title change and new perspective. The guidelines have undergone a complete title change from management of arterial hypertension in the past now to management of elevated blood pressure and hypertension. The question is why? Simply because the risk from blood pressure isn't just black and white, or in this case, hypertensive versus non-hypertensive, rather it's a continuum. So the new title reflects the fact that even slightly elevated blood pressure levels can increase the cardiovascular risk, and this needs to be managed. The second thing, which is a major change, is the new blood pressure category. Now, instead of different categories of high blood pressure classification, which was used in the past, now they have simply classified into three categories, and they are named hypertension, elevated blood pressure, and non-elevated blood pressure. So you see, there's a new category now called elevated blood pressure, which is defined as a systolic blood pressure of 120 to 139 millimeters of mercury, or diastolic blood pressure of 70 to 189 millimeters of mercury. And this is interesting because in the past, there were some readings which were classified as normal BP. So now if you check again, you might have elevated blood pressure despite the fact that you think it's not. This major change in classification allows for earlier identification and intervention for people who might have otherwise fallen through the cracks of the old classification system. The third major change is revised blood pressure targets. And here's the biggie. The target systolic blood pressure for adults on blood pressure lowering medication is now 120 to 129 millimeters of mercury. But hold on, it comes with some important caveats. The treatment must be well tolerated, and for older patients like those with orthostatic hypotension or frail individuals, a more lenient target may be suitable, and your target blood pressure can be still above 130 millimeters of mercury in those cases. So we are not just talking numbers here, we are talking about personalized care. And now let's get into what you've all been waiting for. That is the major treatment recommendations for elevated blood pressure, which is the new category in these revised guidelines. So if you're wondering whether lifestyle changes or medications are still in the mix, you are absolutely right. But the details have evolved. Actually, first things first, if you have got a blood pressure equal or greater than 140 to 90 millimeter of mercury, you need treatment. As simple as that. You still would have to do lifestyle modifications, etc. But the bottom line is you need treatment if your blood pressure is more than 140 by 90, period. And now let's talk about other major treatment changes which have been recommended in these updated guidelines. First thing is lifestyle interventions as the foundation of treatment for elevated blood pressure category. Now, for everyone with elevated BP category, whether you are at low risk or high risk, depending on your age or coexisting morbidities, lifestyle changes are the first line of defense. What it means including your reducing your salt intake, increasing your potassium intake. Yes, they are talking about potassium intake by eating more fruit and vegetables, or using potassium based table salts instead of sodium based, and also maintaining a healthy weight doing regular physical activity, moderating alcohol intake, and saying no to smoking. If these sound familiar, it's simply because these things work. Second thing in the treatment category is when to introduce pharmacological treatment. Now, when do we bring in the medications? Here's the key. It's all about your risk level. Let's say if someone has got a 10-year cardiovascular risk factor or cardiovascular risk of less than 10%, we stick to lifestyle changes first and then reassess. But if that risk is higher, or let's say if there are existing cardiovascular comorbidities like diabetes or kidney disease, then medication might be necessary if the blood pressure remains above 130 by 80 millimeter of mercury after 3 months of lifestyle modification. That simply means that after 3 months of lifestyle modification, if your elevated category systolic BP is equal to 130 or more, or diastolic is 80 or more, you need treatment. Third change are the new BP targets. The new target is the systolic blood pressure of 100 to 129 millimeter of mercury and diastolic between 80 to 89 millimeter of mercury for those who are on medication, provided they tolerate it well. It's a lower threshold than before, you will see. But again, it's all about personalizing the treatment to fit the patient. For someone like a particular older adults or those with certain health conditions, a more lenient target might be the way to go. Fourth change is the medications to be used. In elevated blood pressure category, monotherapy is recommended to begin with, and only if it is not working you should proceed to combination therapy. Now for those in hypertensive category, like with a BP of 140 by 90 and more, combination therapy is recommended. They recommend you start with ACE inhibitors or angiotensin receptor blockers, which should be combined with either calcium channel blocker or diuretics, your choice. But let's say if that combination is not working, then you have to give them a triple combination of ACIs or ARBs with CCBs and diuretics and reassess them after 3 months. If this triple combination is also not working, you have to increase the dosages of this combination. And you see, beta blockers are mostly out of this equation unless indicated wherever necessary, like for example in post-MI, angina, or where you need rate control. So the takeaway here is that the 2024 ESC guidelines for hypertension management are a game changer. They emphasize a more nuanced, patient-centered approach to managing blood pressure. They focus on preventing heart attacks and strokes rather than just hitting a BP number. It's about early intervention, personalized care, and most importantly, saving lives. So if you found this video helpful, please give it a thumbs up, subscribe to my channel for more updates on medical guidelines, and hit that bell icon so you never miss an update. Also share this video with your friends and colleagues who need to stay updated on the latest in healthcare. Thank you for watching, and I will see you in the next video. Bye bye.